Medicine evolves one story at a time. Here's one worth telling. This is History Taking. So have you ever thought about drinking bacteria? Probably not. And did you ever think, hey, if I drink bacteria, maybe that could save a lot of lives down the road? Also probably not. But one doctor decided to do just that. To explain this, let's talk about what people used to think back in the day. People used to think that stomach acid was actually pretty sterile. Why did they think that? It's acid, right? On the pH scale, a healthy human gastric pH is around 1.5 to 3.5. So it's pretty highly acidic. And our basal levels live around 1.5 to 2.0, and after a meal, you see that increase to some degree. This allows a lot of stuff to be broken down in the stomach, and the working theory was that no bacteria is ever actually going to survive in such a hostile environment. Also back in the day, and today as well, people would get peptic ulcers. These ulcers were usually explained through some sort of genetic issue, some sort of maybe personality issue, like you have high stress and that's causing the peptic ulcer, or maybe the person is eating something too corrosive, like a spicy food, or they had a weak constitution in general. This was the logic of peptic ulcers back then, and based on that logic, they had a lot of treatments that focused on addressing those things. Acids could decrease the corrosiveness. Milk diets is the opposite of spicy food, so maybe you drink a lot of milk and address that. Sometimes sedation was even considered because if the person was so stressed and agitated, maybe they just needed a little hit of a tranquilizer, right? And in some cases, it went as far as to do things like a surgery, like a partial gastrectomy, or even a vagotomy to reduce these stress levels. The idea wasn't that ulcers were ever caused by infection, because there's no way an infection could live in our stomach. It was either just the body's too weak or unequipped to handle this type of stuff. Fast forward to the early 1980s in Australia, and there was a physician called Barry Marshall. They worked with a pathologist called Robin Warren. And Warren started to notice, hey, you know what? I'm noticing this inflamed stomach tissue, and there's curved bacteria in there. And Warren starts to notice this pattern over and over again. At first, she considers it, oh, maybe it's some contamination. Over time, though, they see this pattern emerge and realize it's not contamination. It's seen over and over, and people just didn't address it. And Marshall and Warren came together and proposed this idea that it's possible that bacteria was the cause of gastritis in these ulcers. And everyone looks at this and pulls out their favorite statistical phrase of all time and says, correlation isn't causation. Just because it is there doesn't mean that it is causing this. Everyone has bacteria sometimes. And let's be real, we're given all these antacids and milk diets, and that seems to be helping. So we've already kind of solved this problem. Why are you looking into it even more? So at first, they tried to establish a clinical trial with this, and any attempt to do so was kind of ignored. Ethics committees didn't really approve of this idea of establishing a clinical trial for something that's already seemed to be worked out in terms of treatment. And there's no really animal model that we can discuss, and no patient volunteers that are like, hey, let's look into the random bacteria that you found. As a whole, medicine's position about this was nothing's really going on. Why worry about it? But Marshall said, no one's letting me get the evidence, but I believe in it, and I believe the findings that I have. So he was frustrated, and he realized that he wants to get whatever evidence that the clinical boards are asking for himself. So he goes ahead and he cultures the bacteria, and he finds this curve-shaped bacteria, which we know now as Helicobacter pylori, or H. pylori for anyone who's heard of that before. It causes these issues in the stomach. It has that curved shape that's pretty iconic to identify it. And once he cultures it, he decides the most logical thing to do is to drink it. He just drinks the whole thing and allows that culture of H. pylori to infect him. And days later, he starts to experience nausea, vomiting, gastritis, and he goes in for an endoscopy. And what does the endoscopy confirm? Inflamed stomach lining. And what's in that inflamed stomach lining? H. pylori bacteria. He gets antibiotics, and guess what? The symptoms are resolved. And now he showcased, hey, I'm able to induce a disease, document that I've induced a disease, and treat that induced disease with the treatment for this bacteria without any increase or decrease in my stress level. It all has to do with this microorganism called Helicobacter pylori that we have well established to be the causal factor for this case. So he releases his findings. Even after he released them, journalists were still rejecting these papers. Conferences tried to dismiss the findings, and gastroenterologists were pushing back. And the reason why is because their careers were built on the old model of thinking. It has to be due to stress. It has to be due to the acid level. It has to be due to corrosion. It has to be due to this weak constitution. There's an entire industry that was revolving around this idea of acid suppression in the stomach. And the idea of switching the cause to infection would reframe our idea of blame and responsibility. Medicine was too invested in that inflammation model rather than the infection model. But finally, they managed to get their foot in the door and they started these antibiotic trials, which of course start to work. The ulcers only seemed to recur if the bacteria remained in the system, and antibiotics took care of the bacteria most of the time, and when they did, the ulcers went away. The relapse rates for ulcers started to plummet, and surgery rates started to fall. Guidelines slowly but surely began to shift, until finally, ulcers were reclassified. It wasn't just some psychosomatic issue, it wasn't a stress-based issue, it wasn't a personality issue. The treatment was pretty clear. Let's give short-course antibiotics that act as cures, not just management. And then all of a sudden, one of the most common diseases on earth in ulcers became preventable and treatable. Years later, Marshall and Warren in 2005 received the Nobel Prize for their work. Not for drinking bacteria, so please don't go out and drink it yourself, but for using this evidence-based finding that they had to force medicine to change their paradigm, to recognize that, hey, our stomach isn't sterile just because it's acidic. There's actually huge bacterial colonies there, and some of those bacteria can cause us issues. Medicine didn't fail in this case because it lacked data. It failed because it depended on a theory way too much. The stress ulcer theory sounded good. It fit the culture, it fit the findings with what we saw with a lot of patients, and explained the level of some suffering without having to change the system. But thanks to the work of Marshall and Warren, we were able to change that for the better. And a lot of people's lives are improved in a way that we can treat and address the situation much more easily. Congratulations to Marshall and Warren. Please don't drink bacteria at home. If you do, though, hopefully you have a good enough reason that can change a lot of lives like they did and earn you a Nobel Prize. This has been History Taking. Thank you for listening. Want to talk about the latest episode or give us feedback on how to make the show better? Feel free to reach out on our Discord in the show notes below. Want to send support? Feel free to engage with our Patreon. This is just a passion project for us, but we're always looking for ways to make this better. Thanks for listening.